So the CAPTIVATE study is a frontline study in CLL, and it's a study of combination of Ibrutinib plus venetoclax for the frontline treatment of CLL. So by way of background, up to this time, most of the data surrounding CLL have been with chemotherapy, and more recently with the BTK inhibitor studies, the BTK inhibitors have become a standard of care in frontline, but needed to be continued indefinitely. So CAPTIVATE asks the question of whether combining Ibrutinib and venetoclax, so two oral novel agents, may be able to give us a time-limited treatment options where patients can take the therapy for a period of time and then come off therapy in deep remission. In short, 164 patients were enrolled. The patients received 3 months of Ibrutinib, followed by 12 months of Ibrutinib combined with venetoclax. What we found was that the regimen was very well tolerated. It was an entirely oral regimen. Patients had a less than 5% discontinuation rate due to adverse event, and 90% of patients were able to complete the treatment sequence. After the 12 months of combination therapy, patients had very deep responses, and in fact, the minimal residual disease clearance rate in those patients was 75%, meaning that in 3 out of 4 patients were able to achieve the deepest remission possible using an all-oral novel therapy induction regimen. So those are very encouraging results. At the moment, there are different cohorts enrolled in this study. Some patients are assigned to have ongoing therapy, others are assigned to stop all the treatment altogether. So time will tell whether this very deep remission is durable without any requirements of maintenance treatment, and whether this is a viable option as a time-limited treatment. 152 patients completed the treatment sequence in this cohort and are assigned to different maintenance strategies, including no treatment, treatment with Ibrutinib alone, or treatment with the combination indefinitely. Because of the high disease clearance rate seen in this cohort, we have also recruited a separate cohort of patients, and that's 159 patients. And those patients simply received the 12 months of combination therapy and then they stop. Now that cohort is about 1 year behind because the data is less mature. But by the time we're finished, we will have around 350 patients assigned to different strategies, and we can define what the best post-induction strategy is. Really, we aren't seeing any unusual side effects above the expected of Ibrutinib and venetoclax individually. So probably for us, some of the major concerns was tumor lysis syndrome, which is a big issue with venetoclax. But what we found was that after 3 months of Ibrutinib, that almost all the patients who were at high tumor lysis risk have decreased to intermediate or low tumor lysis risk because the Ibrutinib has managed to debulk the disease. So in the first cohort of 164 patients, only 1 patient developed tumor lysis syndrome, and this was a laboratory-only event with no clinical consequence. So I think what this means for the patients is that instead of looking at chemotherapy or indefinite novel therapy, that there is now on the horizon, very soon, a combination of novel therapies that will allow them to take treatment for fixed duration of time and come off the treatment in very good remission and be able to live hopefully normal, treatment-free life for several years.